Hi, I'm Dr. Todd Florin, and welcome back to Heartbeats. That's my video blog name because nobody gave me a better name. I'm a cardiac electrophysiologist, and I'm going to talk a little bit about some of the things we do. I'm a heart rhythm doctor, and what we're going to talk about are fast heart rhythms. Fast heart rhythm is where you feel your heart going bum, 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 bum. Now, there are different types. There's that irregular one that I just did for you, and the regular one, which is bum 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 bum. Usually the irregular one is most commonly a rhythm that's called atrial fibrillation. It's a very, very common arrhythmia. We see it in young people, but it increases in frequency as people get older. And we'll talk a little bit more about the regular one, which is a type of supraventricular tachycardia. Yeah. We use words in medicine that sound really, really complicated. But let's break it down. Tachy means fast, or means really kind of cruddy, like the sort of stuff that you would find in my grandmother's apartment. We'll stick to the Latin definition of fast. Cardia means heart, so fast heart. Supra means above, and the ventricle is part of the heart. So it's an area of the heart above the ventricle that's going fast. That means in the heart, it's the atrium that feeds the ventricle, and that's the manner in which things work. So it's the atrium that's generally going fast, and there are a series of different rhythms that can come from that. We can treat these with medicine, or we can treat this with a procedure called catheter ablation. Catheter ablation is a procedure where we put catheters in through the veins in the leg, and we find the irritable area and make a very discrete and precise burn to fix the arrhythmia. Procedure usually takes about an hour and a half, and it's the reason why I went into electrophysiology, because it represents a cure for an arrhythmia. It's really a great feeling when you take a young man or woman who's been plagued by regularly having to go to the emergency room because out of nowhere their heart starts to go really fast, and they get this horrible look and they feel terrible, like they're going to die and have to rush to the hospital for injections. I often say that this isn't a life-threatening arrhythmia, it's a lifestyle-threatening arrhythmia, because they become afraid to do their normal behavior, their normal activities. By making this discrete burn in this short procedure, they're essentially cured from these things and can go back to normal life. Which brings to mind my fundamental medical philosophy, which is there are only two reasons for us to do anything in medicine. One, to make you live longer. We need to do things to save your life. And the second is to improve your life. So we either make you live longer or make you live better. If something in medicine does not meet one of those two possibilities, we shouldn't be doing it. And for now, thank you very, very much for listening. This is Dr. Todd Florin, and thanks for listening to Heartbeats.